is Harmony. I'm a PN student at Williston State College, and today I'm going to show you some bowel care. I have already went in and assessed the patient. She has hypoactive bowel sounds, hasn't had a bowel movement in 3 days, and her abdomen is distended. So I'm going to go over the provider orders. I have Shirley Coast, 5/14/1964. She's admitted to med-surg with a primary diagnosis of CHF, but she has a secondary diagnosis of chronic constipation. So the provider has put in an order for Dulcolax suppository 10 milligrams rectally as needed for constipation, and also sodium phosphate enema 4.5 milliliter bottle rectally as needed for constipation if the suppository doesn't work within 12 hours. So I'm just going to go over the MAR. We've got Shirley Coast, 5/14/1964, Dulcolax 10 milligram suppository rectally as needed for constipation, and that's daily if needed. The saline laxative enema, 4.5 milliliter bottle rectally as needed for constipation if the suppository does not work within 12 hours. So I've reviewed my MAR with my provider order. I see she's allergic to penicillin and codeine, and that's not going to contradict any of the medications that we have on our list. So I'm going to get Shirley Coast's drawer. So we've got Shirley Coast, 5/14/1964, and we're going to be doing the Dulcolax. So we're going to grab Dulcolax. 10 milligram suppository to be inserted rectally as needed for constipation. It's not tampered with, it looks good. I'm going to wash my hands and grab some gloves. Okay, so we're gonna get some lubrication and put it into the med cup just to make it a more comfortable procedure. Okay. Then we've got our Dulcolax, 10 milligram rectal suppository as needed, and it is not expired, it's not tampered with. And we're going to place this into the med cup. So I did my 2 medication checks. I'm going to wash my hands and remove my gloves, and then head into Shirley's room. Knock, knock. I'm going to close the curtain for privacy and wash my hands as I enter. My name is Harmony. I'm back to do that suppository. Can you verify your name and date of birth? Shirley Coast, 5/14/64. Perfect. I'm just going to raise the bed up. And then I'm going to check her wristband. I see Shirley Coast, 5/14/64, and scanned it. Okay. So do you have any questions about the suppository before we begin? No, you've done one before? Okay. So this is to be inserted, and it should be beneficial within 8 hours, but let us know if you need to go before then. So I'm just going to do one more medication check. We've got Shirley Coast, 5/14/64, the Dulcolax 10 milligram suppository. We scan that in. I'm going to wash my hands and put gloves on. Okay, so we're just going to lower the side rail, and I'm going to put you in left sims, so you'll be laying on your left side here, okay? All right, so I'll have you put your arm across your body and bend your right knee up. And then we'll roll. Try to keep you covered. Then I'm going to place a pad underneath you. Okay, so I evaluate the rectum, and it looks good, or the anus looks good. There's no polyps there. And I'm going to grab my suppository. Get it nice and doused in lube. Okay, Shirley, this is going to go up past your internal sphincter about 3 to 4 inches. So I'm going to insert it along the side of the rectum canal. And then we insert that in 3 to 4 inches. I'll have you hold that in as best you can, and then we can roll you back. Okay. So now she's back. And we're going to put the side rail up. I'm going to wash my hand, or remove my gloves and wash my hands. And now I have the call light within reach. She's at the lowest position. And then I've returned. It's about 12 hours later. She still hasn't had a bowel movement. And I reassessed her bowel sounds. She's still hypoactive. Abdomen is still distended. Okay, Shirley, so you still haven't had a bowel movement. We're going to get an enema that Dr. Leo has ordered for you, okay? Do you have any questions about that before I prep it? No? Okay. So I'm going to go back to the med room. She's back in lowest position. The call light's within reach. I washed my hands as I left the room. So now I'm back at the med station. I'm going to grab a saline laxative enema, 4.5 milliliter bottle to be administered rectally. And that is as needed if the suppository doesn't work within 12 hours. And that's for Shirley Coast, 5/14/64. And we've got Shirley Coast, 51464. Perfect. So we're going to grab the saline laxative enema, do our first medication check, and I see I've got saline laxative, 4.5 milliliter bottle to be administered rectally as needed. It's not expired. I'm going to do a second medication check. I pulled this out of Shirley Coast, 51464's bin, and I see here it's 4.5 milliliter bottle as needed. Doesn't expire. We're just going to make sure the bottle hasn't been opened, and it looks good. So we are going to take this into the room with us. And before I enter the room, I will run it under warm water to make it a good, comfortable temperature when we administer it. So I'm going to knock on the door. As I enter the room, I'm going to close the curtain and wash my hands. Hello, I'm Harmony. I'm going to be doing that suppository. Can you verify your name and date of birth? Shirley Coast, 5/14/1964. Okay, let me just check your bracelet here and scan that in. So we've got Shirley Coast, 5/14/64. Perfect. Okay, I'm just going to do one more medication check. So we've got Shirley Coast, 5/14/1964, a saline laxative enema, 4.5 milliliter bottle as needed if the suppository is ineffective within 12 hours and doesn't expire. This is a pre-lubricated tip, but we're going to add a little bit more lubrication for a more pleasant procedure. So we're going to lube it up. And then I'm going to assist Shirley into left sim. So I'm going to wash my hands. And I had gloves on when I did the lubrication on top of the bottle. And now we are going to lower the side rail. All right, Shirley. So we're going to be doing this enema. You stay in the same position we put you in earlier. But this time you'll have to stay in that position for at least 5 minutes. And let us know if you need anything, okay? Because I'll stay in the room with you. So she's going to roll onto her side. And I'm going to get her a bath blanket just in case. We just don't want to ruin her clean blanket. Doing okay, Shirley? Good. We'll keep you covered here. All right. So we've got the bath blanket on her. That way we don't ruin her sheets or her comforter. Then I'm going to check out, make sure she still isn't having any changes. Looks good. Okay, Shirley, I'm going to grab the enema. This is going to go up in past your internal sphincter about 3 to 4 inches, and we'll go up the side of your rectum and then squeeze the whole bottle in. Okay, I'm going to have you stay in that position for about 5 minutes. I'm going to remove my gloves, wash my hands. Let me know if you need anything. I'll be on the other side of this curtain. So now I'm just documenting that I've administered the saline laxative and the enema, and then I'm just going to prep the stool culture. So we've got our labels, our bio bag, and then our depressor. Okay, so she said that she's ready to have a bowel movement. All right, Shirley, let me help you over, okay? I'm gonna wash my hands and put gloves on. Grab my fracture pan. Okay, Shirley, we're just gonna position this under your bottom here, and then I'll have you roll back. Doing okay? Good. So we keep her nice and covered. You want to position the bedpan underneath her bottom. So her bottom's under that. Keep her covered. We'd raise the head of the bed to 90 degrees. Okay, she's had her bowel movement, so we'd lower the bed again. All right, Shirley, we can remove the bedpan now. So I'm going to put you back on your side, and I'm going to stabilize the bedpan as we roll you so we don't spill. I'm going to place this on the other pad and have you on your side for just a moment, and we'll remove this. I would provide perineal care and then put the blankets back on. Okay, put this in the dirty clothes. And now I'm going to get your stool specimen ready because it has to be to the lab within 15 minutes, okay? So I'm going to grab my bin, place it on my pad over here. We're going to need our tongue blade, So we're gonna scoop, place it in here. It's a greenish brown color, a little bit of a mucousy texture. Place that in the bio bin. Close that. Place a label for Shirley Coast, 5/14/1964. Then we're gonna date, time, and initial the specimen collection, and also place that on the cup. Then we'll place this into the bio bag. I'm gonna discard the rest of this into the toilet, document the output, remove my gloves, wash my hands, and before I left the room, she was back at her lowest position. She has the call light within reach, and I'd remove my gloves, wash my hands, and get this down to the lab. Now we are back in the med room. I have a Shirley Coast 5/14/64. She needs a colostomy bag change. So I'm going to prep the colostomy bag before I enter the room. I know I'm going to need a stencil, a faceplate, and then the bag itself and a clip, along with some of the pre-care supplies. Okay, so we're going to put the clamp on before we enter the room. There we go. And then we'll grab our faceplate and we can head down to see Shirley. So I'm going to wash my hands. I'm going to knock on the door. Hello, Shirley. My name is Harmony. I'm a nursing student. Can you verify your name and date of birth for me? As I entered the room, I washed my hands, closed the curtain for privacy. She said her name is Shirley Coast, 5/14/1964. I raised the bed up, scanned her bracelet. She's Shirley Coast, 5/14/64. Okay, Shirley, I'm here to do some ostomy bag care. Do you have any questions before we begin? No? Okay. I'm just going to sit you up a little bit. Perfect. I'm going to listen to your bowel sounds before we begin, okay? So I'm just going to expose her stomach, examine the ostomy bag. Okay, so she has active bowel sound. She's not having any tenderness. I'm going to put that down. Okay, so I'm going to wash my hands and put gloves on, and then I'm going to be measuring. I'm going to remove the old ostomy bag. So I'm going to just pull this old bag off, okay? Then we can get you a new fresh one. I'm going to place that in the bedpan and place a rag over it and do some stoma care. I see that the stoma is pink, moist, and has good blood supply. So we've cleaned it. I can remove the old sticker or old faceplate, moving it from the edges, working our way in. Doing okay, Shirley? Good. I don't see any lesions or abrasion around the stoma. So I'm just going to leave that there, place this in the bio bin, and then we're going to get our stencil. Okay, so we'll say it's about 1 1/4 inches. So we're going to grab our faceplate and some scissors. Okay. Let's see what we've got, Shirley. We're close. A little bit more off the edges. We don't want to go too big because then you could get some lesions around the edge and it could get super irritated and possibly cause infection. Okay. Just a smidge more. Okay, so I'm just gonna keep that covered. We're gonna use the adhesive tape remover pad. Okay, then we're going to apply a little bit of stoma powder just to help soak up some of that. Get it nice and tacky. I'm going to put my faceplate on my colostomy bag and apply the Adapt paste to the back. Nice layer. Okay, Shirley, we're just gonna apply this. Work our way from the inner to the outer. Doing okay? Are you having any tenderness? No? Okay, perfect. So I've changed the ostomy bag, got her covered, put this in the dirty bin. I'm just going to evaluate the stool from the previous bag, so I've removed the clamp. Pour it into the fracture pan, place that in the garbage or in the bio bin. Then I would note that this is a little bit more formed because it's from an ostomy bag. There's a mid-size amount, and I document the smell, and then I'm going to discard the rest of that in the toilet. I'll remove my gloves, wash my hands. Shirley, is there anything else I can get for you? No? Okay, I'm just gonna lower you back down. Would you like to stay sitting up or do you want to lie down? Stay sitting up? Okay, well here's your call light. Let me know if you need anything else. I'm going to document the bowel from the stoma, or from the colostomy bag. I'm going to document that I changed the ostomy bag, and as I'm leaving the room, I'm going to wash my hands.